my name's Reina. I'm a student at NAU Physical Therapy, and I'm going to be talking about the examination for Reiters syndrome, which is also called reactive arthritis. So this usually comes in a triad of symptoms. It's going to have urethritis, conjunctivitis, and arthritis. So you want to make sure that you take a complete and thorough history with every patient. You want to look for any evidence of a current or a past infection. So you want to check for constitutional signs and symptoms, which is going to be fatigue, malaise, fever, and weight loss. And then also ask them if they have any pain or swelling in the affected joints. And then for the actual examination, for urethritis, you're going to ask them if they've had any discharge. Then you can, if you're a pelvic floor PT, you can observe their genitals for signs of chlamydia or gonorrhea. You want to do a visual eye examination to look for inflammation or redness for conjunctivitis, but this should be pretty minimal. Then for the integumentary system, they could have skin rashes or lesions that are similar to psoriasis. So you're going to look at their toes, their nails, and also the soles of their feet. And then also you're going to examine their hands for dactylitis or sausage digits. And then for their joints or tendons, you want to evaluate their flexibility and range of motion. You can do this passively. And then so for some of the musculoskeletal manifestations, they can have acute inflammatory arthritis. And this is going to be asymmetrical and polyarticular, so that can happen in multiple joints. And then it's normally going to be the large joints of their lower extremity, particularly the knees and the ankles. So you want to check for range of motion in these areas and swelling as well. And they also can have inflammatory back pain, and then enthesitis, which is inflammation where the tendons insert into the bones. And this is most common at the Achilles tendon, at the ischial tuberosity, your iliac crest, your tibial tuberosity, and your ribs. So you want to really listen for any musculoskeletal complaints of pain at these sites. And then that's it. Thanks for watching.
So I mentioned earlier that Reiters syndrome affects the large joints of the lower extremity. So just to do some range of motion passive testing, I'm going to test her knee flexion and then ask if there's any pain with that or any restrictions in motion, as well as extension. And then going into her ankles, you can test their dorsiflexion, their plantar flexion, and then some inversion and eversion.